So, take two. So, treating them as if you're hearing for the very first time.
Yeah.
What inspired you to make this video?
So I am an A&E doctor. I also have a very unique skill set in the sense that I've set up a media company. And I felt that the national messaging wasn't getting to the right people at the right time. So I felt that I had to deploy my skill set in terms of helping my colleagues who are going to be working in A&E over a bank holiday weekend.
So what's the message in the video that you've made?
So the videos that I've made is consistent with national advice issued by the Department of Health in terms of which NHS service they should seek and for which problem.
So just talk us through, for example, why so do you explain the difference between 111 and walk-in centres and so forth?
So no, I mean these videos are designed for, there's a press release that's accompanying them, which you guys have had, and they've all been combined together, which are going out to the public. But they're actually designed for a social media audience. I've set up a social media broadcaster, although I'm not here in that capacity to talk today. I think it's important to get this information to a demographic that make a decision when looking at their screen, whether they're going to watch it within 8 seconds. So they are short videos that are consistent with the national guidance on accessing NHS services.
Are you worried that people might just take the message as being stay away from A&E?
No.
Why is that?
So I'm not worried that people will take the message that people should stay away from A&E because it's consistent with the guidance that's been issued from the Department of Health.
So what would you like to see people doing then?
In what respect?
How do these videos work in terms of you're saying you're trying to advise the public, so what advice have you put out there?
So when I work in A&E, a lot of patients that I see could have been sorted out by going to their GP, for instance. Now, this isn't blaming patients and this isn't blaming GPs, because a lot of patients go to A&E because it's their absolute last resort. But it's a public awareness and it's an education thing in terms of letting patients know that this service can help you in this way and that way. And I think when people are sick or stressed, then they will seek the easiest possible way of helping or seeking help, which is going to A&E. Now, the trouble is the services are not set up at the moment, not just in Lincoln, but across the country. The services are not set up in any way, shape or form to be able to cope with that kind of demand. So if everybody does it, everybody gets worse care.
What are the challenges then? Can you outline a bit more about the challenges that A&E departments are currently under? We know they're stressed, but sort of from someone who's been in that environment, what are we talking about?
That's a very good question. I mean, I think the challenges are we need to be looking after staff, and this is every single A&E department in the country. You have doctors that are the most caring and compassionate individuals in society, but they're being forced to work under a system that's being underfunded. And this isn't just in Lincoln, this is across the whole country. And I'd say Lincoln are quite forward thinking about this in the sense that they have a recruitment drive, they want to get people in, they welcome innovation. I met the CEO in the corridor just today, just chatting to him, and we're going to bring something out called introducing improvement through innovation or via innovation. So to have that kind of access where the CEO is willing to talk to me, I'm nobody, I'm just a teaching fellow, and I'm just starting out my career. So I think the future is positive, the future is bright. But these are short-term fixes, because the national picture in the longer term is we need more money, and we need an open debate in terms of how much money the public are willing to fund a health service.
We're coming into a bank holiday. The Easter bank holiday starts tomorrow for many. What would be your advice? What would you want to see or happen for your colleagues that are going to be in A&E over the bank holiday weekend?
I think we just need patients to access services appropriately. We understand that if the thing that I always say to my patients, and it's probably worth saying to this as it goes to the audience, is if in doubt, then go. There may be a wait, but ultimately we're interested in patient care and safety and quality. And these videos are designed to try and simplify national messaging, which I think it's important to get that message out there. But they are by no means a way of kind of putting the burden on patients to make decisions about healthcare. And if they're concerned, they should attend, and there may be a wait across the country, but they'll be seen and they'll be sorted, and at least they'll be safe. What I don't want is elderly people, elderly patients that have paid into the system for years, avoiding going to A&E for not wanting to be a burden, because I see these patients turning up in A&E, and if I had seen them a day or two earlier, their prognosis would most likely be better, because we've got that window where we can treat them earlier.
Thank you. Thank you very much.
Cool. Thanks, Ed.